What this means for patients and healthcare providers is Dr. Anahita Dua, a surgeon and chair of the Healthcare for Action. Morning, doctor. Thanks so much for being with us.
It's my pleasure. Thank you for having me.
So the Affordable Care Act subsidies have helped a lot of people for a long time. 22 million people will be affected by an increase in their premiums. How do you see this playing itself out?
Well, what's going to happen is because of this rise in costs, many people who want insurance are not going to be able to get it, primarily because it's going to be such a major impact on the family. In fact, basically $400 in a hit is something that most families in the United States cannot afford, let alone doubling or tripling of their premiums. So what that means is that people will start rationing their medications. They will stop going to the doctor. And that just means overall as a country, hospitals and us as the taxpayers will be paying, but paying slower and more over time. So what we'll start to see is people overwhelming the ERs, and of course, people getting sicker, which in turn will lead to increased debt collection, which in turn will lead to bankruptcy, which is unfortunately in this country, healthcare bills as the #1 cause of bankruptcy for patients.
Doctor, we know when it comes to, you talk about patients going to the ER, we know it's because they have to be treated, whether or not they have insurance, but we also know that there could be some people who lose their insurance altogether. What advice would you have for those people who maybe are insured now and could lose it in the coming weeks?
Well, the most important thing is that you have to take care of yourself long term. It is true, and we often say that, when you come to the ER, you have to be treated, and that is true, but all they will treat you for is that emergency. So, for example, if you have a heart attack and you come to the ER, you will get the procedures and the care to get you out of that situation. But then to maintain your health, to ensure that that stent in your heart does not clot off, you need meds. You need to be able to come and see your doctor. And unfortunately, to get those things, you need insurance. So what I will tell people is that it is true, you can use the ER for that emergent care, but it is really important to get insurance so that you can get that continuation of care and ultimately live. And what that means is you have to look into options locally. There are local government options that can help. Urgent cares are cheaper than cares in the hospital itself. And those are important things that you can do to ensure that you can get the care that you need long term.
I would love to go back to the hospitals for a second because you were mentioning, people will start relying on emergency rooms for their care again if they don't have insurance. What the Affordable Care Act did was save hospitals a little bit, right? They were saving a lot of money. How do you see this impacting hospitals?
The problem with this is that people, unfortunately, are not going to be coming to get their care, and that will transfer to a lot of patients showing up and overwhelming the ER. Unfortunately, even today, if you go to the ER, a lot of people have to spend the entire night in the ER, as your public will tell you, because there are no beds in the hospital. So unfortunately now, with people holding off till they get sicker and sicker, and then ultimately showing up very, very ill, we are going to see places just unable to absorb that and ultimately hospitals closing. Because this is, of course, in conjunction with the big, beautiful bill, which also is changing some of the Medicare and Medicaid issues, which are going to unfortunately lead to these hospitals closing. So you're going to have smaller community hospitals unable to tolerate the influx of patients in the ER and simultaneously not getting the money that they need to function, ultimately closing. And that means that our population, especially in more rural areas, are going to be affected quite significantly. And ultimately, we will see that translate to a rise in death. And this is not hyperbole. These are just facts. This is what happens when you don't have insurance. The Affordable Care Act subsidies are not ideal. It's basically like building a road from one place to another with a lot of potholes in it. It's not perfect, but you don't want to get rid of that road before you have some better option. And right now, unfortunately, we do not have a better option.
And Doctor, we know that over the last few weeks since the shutdown, we've seen Congress at least start to discuss tackling this issue. They're expected to do so again when we come back from recess in the new year. What's the messaging you're seeing come out of Congress? And on the other hand, what would your message to members of Congress be as they take up this issue?
Well, the good thing about it is that Congress finally is doing something about it. And this is clearly a bipartisan issue. Republicans and Democrats, everyone agrees that our healthcare system needs an overhaul. We can't do what they're doing in other countries because our country is massive. We've got so many people at so many different income levels. So we're really, as Americans, going to have to figure out something special for us in our country. And of course, we've got the brightest minds here, so we will be able to figure that out. My message to Congress would be talk to the people, bring doctors in, bring healthcare workers in, bring patients in, and really understand the nuances of healthcare in the United States. A great example would be what we just talked about, this kind of floating idea that, hey, if I have a real problem, I can just go to the ER, which is really not true. You need your medications long term, as I mentioned. And so making sure that all the bits and pieces are perfect so that we do not have to sacrifice on quality is fundamentally important for our United States patients. And that's what I would tell Congress to do.
Let's go back to patients for just a moment, because there's the nuts and bolts of it, being able to afford it or losing it. And in either case, there's a huge emotional response to that whole idea of healthcare. Are you seeing that manifest currently in your patients?
Yes, our patients are angry. They are paying massive amounts of taxes. We know that in the United States, of course, education is not free, healthcare is not free, housing is not free, food is not free, and that's a whole different conversation. But the point is that people are paying massive amounts of tax and yet not getting the fundamental rights that they deserve to have happy, healthy lives. And that's making them angrier. When they go and they have a little cold to the urgent care and they get hit with a $500 bill, that's making them angry. And so patients are now saying, what am I paying for if I'm paying with all these taxes? And that is now translating to people really caring about this issue and voting because of this issue. So historically, healthcare has been really important. People have become angry about it, but they've not actually gone to the voting booths about it. And now they are. And that, of course, is important because that's reaching the ears of Congress finally. But unfortunately, it's a little bit too late. And this problem is a big problem. It's not going to be fixed over just a month or 2 months. It's going to take a lot of work from the ground up. And yes, we're going to have to break some stuff that we've built in order to rebuild something great. What we don't want to do, as I've said before, and what the patients are also saying, is do not break what we have, even if it's imperfect, until you have something better.
Doctor, there's of course, kind of transitioning the politics of this issue, and then there's also the health going on. I want to just talk a little bit about as we enter, continue through the winter months, enter the new year. What are some of the health trends that you're seeing, and what should we all be aware of as we go about this holiday season?
Well, the big thing that we're seeing, and I'm sure you have friends and family, is that flu going around, getting everybody and taking kids out of school, making grandma stay home. And unfortunately, it's around the holidays. So, of course, we all want to gather for Christmas, gather for New Year's, and people are concerned because they don't want to get sick. Unfortunately, the specific flu virus that's hitting everybody this year is pretty aggressive. We know that because we can tell what's going on in the rest of the world as it sweeps to the United States. And with that, of course, we're also seeing RSV, which is another type of virus. And of course, COVID is always lingering around. So you've got these 3 horrible respiratory viruses that are getting people and really knocking them off their feet for a week, 2 weeks. You have, unfortunately, in conjunction with that, people getting vaccinated less for a variety of reasons, as we all know. And of course, with our children, their immunity has been a little bit lower because of what happened in the COVID years and them not having the exposure that they had originally. So this combination has made this particular season a little bit more aggressive. And so we're seeing, of course, our ERs and our urgent cares overwhelmed with this particular type of patient group. And that's something that's been a concern. But the most important thing you can do there is hydrate. Take care of yourself in terms of staying away from people that are sick contacts. And of course, if you're not vaccinated, do get vaccinated, because even if you get the flu, it will not be as aggressive as it would be if you were not vaccinated.
Dr. Anahita, thank you so much for being here. Here's to